Testing placental hormone levels can help identify candidates for pregnancy complications. Ladies who will foster possibly dangerous issues during pregnancy can be distinguished early when chemical levels in the placenta are tried, another examination has shown. Pregnancy problems influence around 1 of every 10 pregnant ladies. Practically the entirety of the organ frameworks of the mother's body need to modify their capacity during pregnancy so the child can develop. In the event that the mother's body can't as expected adjust to the developing child, this prompts major and basic issues including fetal development limitation, fetal overdevelopment, gestational diabetes, and toxemia, a perilous hypertension in the mother. A significant number of these difficulties lead to troublesome works for ladies with more clinical mediation and long-lasting issues for the child including diabetes, heart issues and corpulence. Pregnancy issues are typically analyzed during the 2nd or 3rd trimester of incubation when they genuinely affect the well-being of the mother and child. The current techniques to analyze pregnancy issues are not touchy or solid enough to recognize all in-danger pregnancies. Presently researchers have figured out how to test chemical levels in the placenta to anticipate which ladies will have genuine pregnancy intricacies. Dr. Amanda N. Sferuzzi Perry, a fellow of St. John's College, University of Cambridge, runs a lab in the Department of Physiology, Development and Neuroscience and is the lead creator of another paper distributed today, June 8, in Nature Communications Biology. The female body is momentous and from the snapshot of origination, a pregnant lady's body needs to change virtually each and every organ framework so the baby can create. The embryo additionally needs supplements and oxygen to develop, so the mother needs to change her digestion and vascular framework so she can give them. We realize that the placenta drives a large number of the progressions in a lady's body during pregnancy, and our examination discovered hormonal biomarkers from the placenta could demonstrate which ladies would have pregnancy intricacies. We tracked down that these biomarkers are available from the primary trimester of pregnancy. Ordinarily ladies are just determined to have intricacies during the 2nd or 3rd trimester when problems may as of now have had genuine ramifications for the strength of the mother and her creating child. This is an exceptionally significant discovery given that pregnancy problems influence around 1 of every 10 pregnant ladies and are frequently analyzed past the point of no return when the confusions are unleashing destruction on the mother's body and the fetal turn of events. Dr. Amanda N. Sferuzzi Perry, Fellow, St. John's College, University of Cambridge. The placenta is a complex natural organ. It frames and develops from the prepared egg, and connects to the mass of the uterus. It permits supplements and oxygen to move from mother to child, and eliminates fetal side effects. Notwithstanding its significance, the placenta is an extremely gotten organ and is famously hard to concentrate in pregnant ladies. However, its capacity to work appropriately is indispensable as it impacts on pregnancy results and the deep-rooted well-being of mother and kid. Diminished rates of birth during early pandemic are anticipated to bounce back soon. Coronavirus in pregnancy could be less serious than recently suspected, a Danish contextual investigation. Advanced medical care could help convey customized counsel to ladies encountering pregnancy challenges. The placenta creates during pregnancy and associates the creating child to the mother. It fills in as the lungs, kidneys, gut and liver for developing infants and conveys oxygen and supplements to the baby while discharging chemicals and disposing of waste. Utilizing mouse models, analysts took a gander at the proteins made by the placenta and contrasted them with blood tests from ladies who had routine pregnancies and the individuals who created gestational diabetes. The group grew new strategies to separate and study the endocrine cells in the mouse placenta on the grounds that these phones are answerable for discharging chemicals during pregnancy. They profiled the placenta to distinguish the chemicals that are emitted to make a far-reaching guide of proteins in the baffling organ. The mouse model guide of hormonal proteins from the placenta was then contrasted in datasets from investigations of the human placenta and pregnancy results, and scientists found a great deal of organic cover. Dr. Sferuzzi Perry said, "We found that around 33% of the proteins we distinguished changed in ladies during pregnancies with messes. Utilizing a little report to test if these placental proteins will have some clinical worth, we additionally found that unusual degrees of chemicals were available in the mother's blood as right on time as the principal trimester, week 12 of growth, in ladies who created gestational diabetes, a pregnancy confusion for the most part analyzed at 24 to 28 weeks. We additionally recognized a few explicit record factors, proteins inside the cell that turn on or off qualities, that are probably going to administer the creation of placental chemicals which have significant ramifications for seeing how we may improve pregnancy results. The researchers investigated whether these hereditary biomarkers were recognizable during pregnancy and utilized an examination that followed pregnancy results in ladies at Addenbrooke's Hospital in Cambridge. They found that blood tests showed these biomarkers in early pregnancy, which could prompt prior conclusion of complexities permitting treatment to start all the more rapidly. Dr. Claire Meek, a diabetes in pregnancy doctor and analyst at Addenbrooke's, said, "This pregnancy-actuated type of diabetes causes sped-up development of the child and complexities at the hour of conveyance. Tragically, a few ladies as of now have indications of a major child at the hour of conclusion at 28 weeks. This new test could possibly recognize gestational diabetes prior in pregnancy, giving freedoms to forestall the illness, or to shield mums and children from the most hurtful inconveniences." Dr. Sferuzzi Perry said, "This work gives new expectation that a superior comprehension of the placenta will bring about more secure, better pregnancies for moms and children. Our group is presently attempting to survey if these revelations could improve clinical consideration in future, either through prior determination or to give new freedoms to treat these pregnancy inconveniences by focusing on the placenta."